Today's question is, Doctors of Reddit, what was your worst? I don't think this is important, but patient.
Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine. His knee hurt a bit, but logically that was from the fall. I agreed, but asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. In the end, had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Me? Any prior surgeries? Patient? No. Me examining them. Did you know that you only have one testicle down here? Patient? Oh yeah. I had one cut out. I always asked specifically about gallbladder, appendix, and testicles because patients forget about having a fucking organ cut out. Me, do you have any medical history? Including things like heart attacks, strokes, high blood pressure. Patient, no, nothing ever. Me, so why do you take list of heart meds? Patient, oh, I've had multiple cardiac arrests. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point, he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital and imaging showed cancer, with a tumor pressing onto his spinal column. Although he started treatment and steroids that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease. But I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. So I'm not a doctor, but my mother recently passed away from a variety of things that sort of cascaded on top of each other that resulted from her excessive alcohol abuse. Just for context, she was a 56-year-old woman with a belly the size of a full-grown watermelon, and she looked like she was pregnant even though 19, was her last child. For the past 2 years, my mom had been in and out of hospital because of liver and kidney issues that she brushed off as genetic weakness, I suppose, but never owned up to it being a direct result of her inability to stop drinking. Whenever I would call an ambulance when she fell over, she would deny anything was wrong and begged me not to, even though I knew she needed the help. Fast forward to a month before she passed away, she had a hemorrhage in her bowels while drinking at an old friend's house and was immediately taken to the hospital. There was no part of the bathroom that wasn't covered in blood. I wasn't told about it until the morning after because it was at something like 2 a.m., but I woke up to calls bombarding me and telling me to make my way to the hospital again. I had lost count how many times. When I arrived, the doctors said it was a simple hemorrhage and it was an easy fix, and I asked if it had anything to do with her other health problems, me being an 18-year-old fresh out of high school and no medical training. And they looked confused and asked me what I meant. Apparently, the doctors had no clue about the other endless medical issues she was experiencing, which included a broken hip from a fall she had incurred just before Christmas, because she was taken to a different hospital than usual. Apparently, the doctors there didn't know she was on heavy painkillers and another 15 or so medications before medicating her for this issue. It was another month until she fell into a coma from septic shock and she couldn't recover because her liver was too weak to handle it. I'm not posting this for sympathy, and I realize it might be a little bit off topic, but please be aware of the people around you and what they're dealing with. You never know if a simple night out with the friends could be the last night out they spend with anyone. Be careful and always remember to drink responsibly. Did a bunion and Hamodo surgery on a lady with no allergies. New patient packet, primary care note all had no known allergies. I always ask about metal allergy anytime I plan on putting in hardware. Surgery goes great. I'm on call for the practice and receive a phone call for the group 18 hours post-op. Her nerve block had worn off and she was in excruciating pain. Give instructions on what to do. Next morning, she is in my office before I even arrive. 10 out of 10 pain, sweating profusely, blood pressure elevated. Foot is massive. Clearly not faking it. Have to send her to hospital for intractable pain. Blood work indicates elevated eosinophils, but everything else normal. No blood clot or infection. Hospitalist convinced it's complex regional pain syndrome. I rack my brain and think if WTF could be going on. I am only 5 months out of residency. My butt is puckering so hard. Since eosinophils elevated, ask if she is allergic to jewelry? Yeah, my tongue swelled up when I had it pierced. I had it removed the next day. She had a freaking nickel allergy. No allergist will see her to confirm, so this is all speculation, but makes sense with the hardware I used. Once the hardware is removed and exchanged for titanium, her pain resolved. There was one case in my residency of hardware allergy, January 300 cases I was first or second assist on. If I did not scrub into that case, I don't know if I would have figured this out so quickly. Crazy case. Now I always ask, have you ever had any reactions to jewelry? A lot of patients won't tell you about problems with jewelry and may not know they have metal allergies. Was called to the ER to do a psych consult on a patient that was complaining of GI symptoms, but his story was sorta strange, and he had no overt abdominal signs or symptoms. He was complaining that he suffered from Barrett's stomach, not esophagus, and had been diagnosed by a world-famous gastroenterologist. He stated that if he could lose weight that his GI issues would resolve. I spent some time talking with him, and other than this strange fixation on his Barrett's stomach, he seemed okay. Until he mentioned that his most recent weight loss method was to shoot himself in the thigh, so that the leg would become gangrenous and eventually need to be amputated. This would allow him to quickly lose the 20 or so pounds needed to cure his stomach ailment. The man actually had a self-inflicted gunshot wound to the thigh from several days before. I didn't actually assess the wound because I was there for a psych consult, but did immediately alert the ER staff. I was all calm and nonchalant like, "Oh sir, excuse me for a sec. I'm gonna pop out and let another staff member know about this so they can take a look at it for you." The ER was located in a county that employed a staff of mental health social workers to place psych patients, so I had to call one of them out while he was getting thoroughly physically assessed. I have no idea what happened to him, but I hope he's doing okay. Pharmacy. Had a patient come in for a med for migraine prophylaxis. This was and is an expensive med. White lady in her mid-40s and just wore about 7 crucifixes/religious items. Certain meds in this category can be immunosuppressants, and so we need to check to make sure those patients are not already immunocompromised: AIDS, cancer, lupus, MS, etc., etc. A disgusted and strong NO at AIDS and a nada all the rest. 2 days later, she's back. Wants a full refund. Why? Because after picking up her meds that night, she held off on taking them for a day. The next day, she goes to see her oncologist, who asked about her headaches and if they were getting better or worse. She mentioned to her doc that she'd seen a walk-in clinic doc who RX'd the med for migraine to her. Why didn't she go to oncologist or GP? Oncology appointment the next day and GP was booked that day. Urgent care was a long wait, so the walk-in clinic seemed like my best option. Why does she want a refund and couldn't take the meds? I've got a brain tumor, not cancer. You said cancer, not brain tumor. So if you would have told me the right thing, I never would have paid for it. Reached out to the walk-in doc. No HX of cancer or tumors. Just that she had bad headaches, and he doc did meds could help that. But her usual doc was not available, and so the doc did a perfunctory test and suspected impossible migraines, so a small dose, 1 week. Until she could see and follow up with GP was doc recommendation. Headaches, tumor. Yup. No need to mention those to anyone or put 2 and 2 together. And this is the end of today's video. I hope you liked it, and don't forget to comment an anecdote or experience similar to the topic of the video. Leave your like, share if you liked the video, and lastly, don't forget to activate the little bell so you don't miss any of our daily videos. Bye-bye.